A stroke is a brain attack, a sudden interruption in the blood supply to the brain. It's a medical emergency requiring immediate attention and swift action to minimize damage. Strokes occur when the brain's blood supply is disrupted, leading to brain cell damage and potentially severe consequences. Time is brain, meaning every minute counts in stroke treatment. The faster the response, the better the chances of recovery. As a nurse, understanding stroke is crucial. Your role is vital in recognizing the signs and symptoms early. You are often the first point of contact for patients experiencing stroke symptoms, making your assessment skills essential. Your quick thinking and actions can significantly impact patient outcomes, potentially saving lives and reducing long-term effects. This essay will delve into the complexities of stroke, providing nurses with the knowledge to deliver timely and effective care. Understanding the different types of strokes, their causes, and the latest treatment protocols will empower you to make informed decisions in critical moments. A stroke or cerebrovascular accident, CVA, happens when blood flow to a part of the brain is interrupted. This interruption deprives brain cells of oxygen and nutrients, causing them to die rapidly. Strokes are a leading cause of death and long-term disability worldwide. The effects of a stroke depend on the area of the brain affected and the severity of the damage. They can range from mild weakness to complete paralysis, speech difficulties, memory loss, and even death. There are two main types of stroke: ischemic and hemorrhagic. Understanding the differences between these two types is crucial for effective treatment and prevention. Ischemic strokes are more common, accounting for around 85% of all cases. They are primarily caused by a blockage in an artery that supplies blood to the brain, often due to a blood clot. These clots can form in the heart or other parts of the body and travel to the brain, causing a sudden interruption in blood flow. This lack of blood flow deprives brain cells of oxygen and nutrients, leading to cell death. Hemorrhagic strokes, on the other hand, occur when a blood vessel in the brain ruptures, leaking blood into the surrounding brain tissue. This type of stroke is less common but often more severe. The bleeding from a hemorrhagic stroke compresses brain cells, leading to significant damage and increased pressure within the skull. This can result in more extensive brain injury and complications. A transient ischemic attack, or TIA, is often referred to as a mini-stroke. It occurs when blood flow to the brain is briefly interrupted, causing stroke-like symptoms that typically last for a few minutes to a few hours. TIAs are critical warning signs of a potential major stroke and should never be ignored. Recognizing and addressing these symptoms promptly can prevent a more severe stroke and save lives. Section 4. Causes and risk factors. The roots of stroke. Understanding the causes and risk factors of stroke is crucial for prevention and timely intervention. Several factors can increase your risk of having a stroke. Some you can control, while others you cannot. Modifiable risk factors include high blood pressure, high cholesterol, diabetes, smoking, obesity, physical inactivity, and an unhealthy diet. Non-modifiable risk factors include age, gender, family history of stroke, and previous stroke or TIA. Section 5. Recognizing stroke symptoms. Act fast. When it comes to strokes, every second counts. The faster you can identify the symptoms, the better the chances of minimizing long-term damage. Recognizing stroke symptoms quickly is vital for prompt treatment. Immediate medical attention can significantly improve outcomes and reduce the risk of severe complications. The FAST acronym is an easy way to remember the most common signs. Facial drooping. One side of the face may droop or become numb. This can be a clear indicator that something is wrong. Ask the person to smile and see if it's uneven. An uneven smile is a telltale sign of facial muscle weakness. Arm weakness. One arm may become weak or numb. This weakness can make it difficult for the person to perform everyday tasks. Ask the person to raise both arms and see if one drifts downwards. If one arm drifts downward, it could indicate muscle weakness or paralysis. Speech difficulties. Speech may be slurred or difficult to understand. This can be one of the most noticeable symptoms of a stroke. Ask the person to repeat a simple phrase. If they struggle to do so, it could be a sign of impaired brain function. Time to call emergency services. If you observe any of these signs, even if they are temporary, call 911 immediately. Quick action can save lives and improve recovery chances. Other symptoms include sudden numbness or weakness on one side of the body, sudden confusion, which can make it difficult for the person to understand or respond to questions. Trouble seeing in one or both eyes, which can come on suddenly and without warning. Sudden difficulty walking, dizziness, loss of balance or coordination, which can make it hard for the person to move around safely, and a sudden severe headache